Good morning, friends. Welcome to another edition of MedWell Unscripted, Florida Style. I hope everyone is having a great day. We're really excited to be here. We have a great guest with us today. And just a little bit about MedWell. We are your medical marijuana specialists. If you have any need for your medical marijuana certification, we are your go-to place. So welcome. Today is being recorded. And if you have any questions and you're catching the replay, feel free to leave a comment afterwards because we will be sure to make sure that we answer all of your questions. And I also want to give a shout out to, we have our very own Kayla, who is in our chat helping answer questions and also share some great links with you. So let's get started. Today, we're talking about, at MedWell, nonprofits are near and dear to our heart, and we love to share stories of people making a difference in our community. And today we're going to be talking about Saving Our Seniors, which is a very special organization here locally in Florida. I'm going to introduce our ladies. I'm going to start with Nicole Stewart, who is our Director of Community Outreach. Hello, Nicole.
Hi, good morning. Thank you for having me. And I'm so excited to have Kelli here with Saving Our Seniors. So Kelli, thank you so much for joining us.
Yes, and Kelli Castro is the founder of Saving Our Seniors. So welcome, Kelli. How are you today?
Great. Thanks so much for inviting us on here to share our story with others. So
awesome. So I'm just going to start, Nicole, share a little bit about what you do at MedWell, because I think it's always a great lead into when we start talking about our guests and kind of and what MedWell is doing here in the community in Florida.
Sure, absolutely. So my mission here in Florida with MedWell is to spread as much education and awareness about medical marijuana and improving the lives of our community and beyond. So I reach out to organizations, meet as many people as I can, such as Kelli, that is really trying to make a difference in the community. Our population here in Florida, as you know, is the biggest retirement center in the United States. So obviously, helping our senior citizens is probably one of the main objectives. We see a lot of patients here that are in need, and they come to us. So connecting with Kelli and seeing what she's doing also helps us reach out to more people and let them know that people do care about them. And MedWell absolutely wants you to live the best life possible.
Awesome. So Kelli, share with us, tell us a little bit about what your role is, and then I would love for you to lead into your story of how you created Saving for Seniors, because it's, it's amazing when I look at when I first was introduced to you and kind of looked at all the services you offer, I know there's a big story behind why you're doing, you're living your passion and helping seniors in our community.
So I started Saving Our Seniors about 4 years ago. My background is in occupational therapy, and I was always kind of the therapist that really wanted my seniors to be able to return home after any type of illness or a stroke that they might have had. So prior to Saving Our Seniors, I would utilize other charities that kind of did what Saving Our Seniors is currently doing. But it came to a time where I think there was too much need or there wasn't enough equipment. So I would kind of rally together with my therapy friends, and we would go purchase, a hospital bed or a power wheelchair, or even something as little as a slide board to allow our seniors to return home. And 4 years ago, I had some things change in my own life. And I thought, well, I'll start it and we'll see kind of where it goes. Sitting here today, I would have never thought that I would still be doing it 4 years later. I thought maybe I would do it for a couple months and kind of move on from there. But it was really crazy just to see, from starting it in my 1-bedroom apartment and now being in 15,000 square foot warehouse, the need. And it was just day after day, seniors would call me and we would be able to provide them that piece of equipment that they really needed. And I always say, I feel like it's the seniors that keep it going for me. Bringing something as little as an adult pull-ups can be life-changing for them. So that is how we kind of started Saving Our Seniors. And then during COVID, we kind of shifted the charity in a lot more directions. because I had seniors calling me on a daily basis needing food and other items, and I would try to rally and give them other resources in the community, but unfortunately they weren't meeting the requirements for them. So we started our meal program during COVID, and I think we've put out probably 20,000 meals to seniors.
That's amazing. Amazing.
And you know what's important, Kelli, is thank you for doing that, because that's huge. And it really, being in the medical field on the traditional side that I was in for 27 years, I worked with mostly geriatric patients. And it was so sad to see them come in. You know, I got to know them over the 16 years, you know, them coming in follow-ups and seeing that they're actually co-pays are a choice between healthcare and sometimes food. And it's really sad in this area particularly. So I appreciate that. That's huge. That touches my heart.
It does.
I mean, I think
go ahead.
I think as a society, we view that seniors are taken care of. You know, they have Medicare and you know, they've saved their life. But, you know, a lot of people that I do help, they did have a good amount of money, and then maybe they got sick early and they had to retire, or, you know, they're on disability now and they're getting a check of $800, and that $800 has to pay for their rent and their utilities and, you know, their transportation. Just you know, even using, I know DART is in Pinellas County that we have, it's like a $5 trip each way. And you think of somebody that's in dialysis, that's 3 trips a week at that money. And, you know, they just are living on barely any money. So our meal program, you know, we started it and it's been pretty much free for the seniors. Sometimes we charge like $1 a meal, and we've been able to be able to help so many seniors with different insurance companies and doctors' offices have helped support us.
Right. Well, and you know, you bring up a good point, and not to get into Social Security or anything like that, but at the end of the day, we're living longer, right? Because we have better technology and better healthcare resources, and so people, when we start saving for retirement, or if they retired at an earlier age, that's, you know, it's really hard. I know that you know, my grandmother, she ended up not having enough money for rent and ended up living with my mother. And you know, and of course my mother loved being her caregiver on certain days, but at the end of the day, it was about the financial, right? So, and not everybody has that support system, so you're doing an amazing thing. Let's go back to the equipment program. So share with everybody how it works. I know one of the things that when you and I were talking last week, that you were saying, it's not about necessarily needing medical equipment at this point in time, but like now you want to find people that can actually use it. So let's talk about the types of medical equipment that you have, kind of that program, and how that process works.
Yeah, so we do, during COVID, I actually launched an online thrift store. So all of our medical equipment is on our website, where you can view, you know, different items that we have. But we have anything from, you know, adult pull-ups to hospital beds. We have wheelchairs, manual and electric. We have pretty much any type of equipment that you need. We have probably over 4,000 pieces of equipment that have come in over the years. And so our main program is, you know, you have to be 55 and over with a disability, or 65 plus. And then you have to make less than $1,500 a month. We typically only verify if your income is zero, just for that purposes. And we have a simple application. It's literally your name, your address, your phone number, height and weight, and what type of equipment that you're looking for. And then once we receive that application, if it's a smaller item, you typically receive it within, you know, the day or 48 hours. If it's a larger item, those are typically put out on the weekends, because I do work a full-time job during the week. So pretty much every evening and weekend I dedicate to either delivering or picking up equipment. And then during COVID, I started the thrift store because I find that a lot of seniors, even though they're making over $1,500 a month, they still don't have the ability to pay for, a shower chair that might be $40, or, a power wheelchair that's not covered through their insurance, can be very pricey. So we put those items, and then 100% of those proceeds go back to the charity to continue to help the ones that can't help themselves.
Interesting. And so when that's an amazing turnaround on 24 hours, on the smaller items. Can you talk a little bit about how that happens? So they make their application, then you're setting up an appointment. Do you help? Because I know that certain pieces of equipment, they're sizing, right? So when you deliver, and especially with COVID, it's really challenging right now. So how does that work? And do you help custom fit like the walkers and all of that? I know you said you ask for weight and height, but I'm sure that there needs to be some kind of adjustment when you see them.
Yeah. Well, during COVID, the meals have been more of a project for us, but prior to COVID, the equipment that goes out, we do, adjust it to their ability, or we give them tips like a shower chair. When you sit down, you want to make sure it hits the back of your leg, like where your knees bend. For your walker, you want to make sure like you put your arms down and it hits you right at your wrist. So we kind of can give those tips to them far away. If we are delivering hospital beds or whatnot, we are fully masked with, even our face shields on. And then we can set up the equipment for them. They've been allowing us in because they need the equipment to be able to kind of live a independent life. Prior to that, they weren't thriving as much as they can. And I always say, like, if you don't have somebody that needs medical equipment, you don't really think about how a wheelchair or a walker can really like change that person's quality of life.
Sure.
Because I know, I've been doing the nonprofit for 4 years, and like medical equipment, people just haven't, gotten on the bandwagon of wanting, I think, to support the charity as much, because they don't understand, even something as small as like adult pull-ups. Like, you have to think that senior could be incontinent. They don't want to go outside. They're fearful of having an accident. And, a package of adult pull-ups at Walgreens is like $15. Mm-hmm. So you can't, they can't afford that, where they can come to us and they can get a whole case for a $5 donation per se, or, so it's medical equipment is so vital to keep those seniors thriving. I remember I helped a woman that needed to take it. So she's been sponge bathing for like 8 months. And I mean, a shower is just a game changer, I think. And you and I, we take taking a shower for granted. We do it every morning. We don't even really think about it. It's just our morning routine. And I helped a lady, Elizabeth, and she had kept calling so many different agencies before she met our nonprofit. And I was able to deliver her a shower chair right away. And within 8 months, she had not taken a shower. And she still calls me like on a weekly basis just to let me know, like, thank you for listening to me. And thank you for like truly filling in that gap, because, something we take for granted, she now can do, but she couldn't do it because she couldn't afford a shower chair because her income was less than $500 a month. And she just had to go without it because, as Nicole said earlier, meals or prescriptions or something are more important than, I guess, taking a shower.
So what types of medical equipment do you offer? Because you mentioned, you mentioned the pull-up piece. So there's lots of different things. So what types do you offer that people could apply to for themselves?
Oh, okay. So we have the adult pull-ups as a section. We have incontinence supplies. We have wheelchairs, manual, electric, high back, tilt and space. We have different kinds of walkers. We have 4-wheeled walkers, rolling walkers. We have like the standard walker, an up walker. We have those type of walkers. Shower chairs. We have shower chairs with a back, without a back. I mean, pretty much any piece of equipment that you can imagine. We have, with wheelchairs, we have wheelchair cushions. We have specialty cushions like Roho cushions. Those are really, really expensive. So those are a hot item. We have the high-low air mattresses. We have, really anything that you can simply imagine we have within our inventory. And if we don't have it, we will purchase it up to $200 for a senior, so we can truly like fill in that gap and really continue our mission of filling in the gap. You can have a mission, but actually doing the work and filling it in is truly important for our charity.
Awesome. So, thank you. So let's talk a little bit about your meal program. So I know that you said due to COVID, you kind of added the meal program, and I know, you're talking about everyday meals. And then I know even with the holidays coming, that especially this time of year, because I know that there's lots of organizations that are, and with COVID, food banks trying to get food in. So can you share about the meal program? And then another important piece to that is how people can get involved and help with that.
So I partnered with Feeding Tampa Bay, which is the local nonprofit in Tampa. I had met them during a competition that I was in a couple months prior to that. And I actually had a senior from Sarasota that kept calling me that needed meals during COVID. And I always wanted to start a meal program, but I did not want to start it right now. But I'm the type of person that I'll just start a program and we'll just work out the kinks while we're doing the program. So I drive like a Chevy car, and it's like very compact. And I've literally probably fit like 750 meals in there, and I go and divvy them out all around the
I think I've seen you drive around the road with your car packs.
I know, I'm always packed. So we provide frozen meals. They're through different private catering companies in the Tampa Bay area that I feel like have been furloughed or not really doing their events. So they provide the meals. So they're all a protein, a starch, and a vegetable. And then we typically provide, when we first started, I was doing like 14 meals because I'm like one person and I kept delivering to the same people. But now we do like between 5 to 7 frozen meals, and we provide them in assortment. And we've been delivering either to private homes, but a lot of like the apartment, like lower income apartment buildings have been a big project for us. I've been based in Nellis and Hillsborough for 4 years. But I'm slowly coming down to the Manatee, Sarasota area. So we are starting to work in some of the Sarasota buildings, which is really awesome because I just love helping seniors. And we're not a Meals on Wheels. So Meals on Wheels provides a hot meal a day. We provide just 5 frozen meals, and it kind of helps them, fill in the gap, even maybe because they don't have financial abilities to get meals. And also with COVID, they're not going out as much. So we provide that for them. And then also for our meal program, a lot of seniors have been asking for like fresh produce or, non-perishable, healthier foods, tuna, like pasta. Pasta isn't healthy, but it's still, it's a good staple for them. They can get a few meals out of it. So that is a new component that I have been working with. That we had some local churches in Clearwater area, like Pinellas County, helping, and that was great. So we're looking for more people that want to donate non-perishable foods to our charity. And also the meal program, we have been getting the items for free, but that will be coming to an end. So we're always looking for corporate sponsors, because I don't think our meal program will ever go away. There's such a need for meals. And I think the frozen meal component can just add, some nutrition and quality of life for them.
Awesome. So I kind of wanted to transition to Nicole for a few minutes and talk about, MedWell is very active in supporting the community. And I know that we do a lot for seniors at MedWell. Nicole, can you share a little bit about how we help seniors not only with their medical marijuana certifications, but just really the process of how we work with them, and then if there's any discounts available, because I think that's an important piece because we see a lot of seniors on a daily basis in our offices.
Yes, that's very true. And, I'm proud to say that MedWell, we have literally seen more senior citizens than we have, the younger generation. And that's obvious because they're the ones who have the chronic illness and pain. And most of them, I have to say, a lot of questions is, do we take insurance? And no, we don't take insurance, obviously, because it's not federally regulated, but they don't even have traditional healthcare insurance. So that's another big issue that I see. So with the senior citizens in MedWell, they're coming to us, obviously, to improve their quality of life. So they've been living either with going through chemo, have cancer, they have, Parkinson's or dementia, chronic pain, any of those things, they come to us. And it's usually a family member that suggests it to them because they do have that fear and that stigma attached to it. So we take our senior population, we help them through registration process. We actually, hold their hand through it, being that with COVID, everything basically pretty much is through the internet. And I'm sure Kelli can attest, a lot of our senior citizens don't have that capability of either having a computer or having a smartphone or even know how to use the technology. So we're here to help our senior citizens through that process and give them a better quality of life. That's what's so fulfilling about my job. People always say, you work, MedWell, we work so hard. And our physicians truly go over their medical history with them to see exactly what can help them. And when we can improve their quality of life through the use of cannabis, taking away that chronic pain or helping them relieve their symptoms, it's an amazing journey. So we take that journey with them. I have a lot of adopted grandparents over the years.
Awesome.
I have a soft spot for them because I work with them and they're so wise and they're so smart, and they just, I often feel go unrecognized and forgotten about, like Kelli had said, and we just want to bring awareness. And MedWell's here, obviously, to support anything to do with senior citizens and anything we could do to help. And that's why Kelli and I clicked right off the bat, because we have that same passion. We're both from traditional healthcare. She was an occupational therapist. I was a CT technologist. So we know exactly what they need. MedWell is accepting non-perishable food items for saving our seniors. So we can help fill that gap for Kelli in getting the food to the people who truly need it, especially during this time. A lot of them are isolated from their family members. I can't even imagine having a need as something as small as a walker and not having it available. We want to be able to reach out and work with Kelli in getting the supplies, and obviously donations. Anybody that a larger corporation that wants to make a donation to saving our seniors to help them, that would be much appreciated, and MedWell would appreciate that as well. So our senior citizens here, wherever they come from, we will sit down with them, talk to them, explain to them how it works. And obviously, they can always come to us with any questions or follow-ups they may have. And I have to say that when they come back after the process and they start feeling that relief, they come back and they actually are so thankful that they found this. So we're doing our part as well for the senior community, just more in an alternative health way, which is improving the life. I know we always say live well, but with MedWell, we do want you to live well. And we feel like we're a huge part of that sector. So being in the circle of care with physicians or organizations where we can help contribute to our community and the people in need, that's what we're here for. So anybody that's suffering from any kind of ailments, please reach out to MedWell. Whether you're seasonal or a full-time resident, we're here to help you. senior citizens and any age alike. But today the focus is on saving our seniors and want to get that word out, especially with COVID and the numbers rising here. We really want to reach as many people as we can and realize that this is a really serious problem. And I have to commend Kelli, tell Kelli, you know, kudos to you for donating all the time you have. I mean, you haven't had a day off in 8 months, and that shows your passion. Yeah. And I'm just so truly grateful for what you do, and I'm excited to be part of it. And I think I just am so admire you so much. So as simple as anybody that can donate some non-perishable food items to MedWell, and we can get that to Kelli. Anybody that wants to make a donation, Kelli would be so happy to accept that cash donation for saving our seniors. And of course, MedWell is here also for your healthcare needs, alternative therapy using cannabis.
So thank you. So Kelli, you know what? I would love for you mentioned Elizabeth as a story, but I think one of the things that really sends the message home is stories that have touched you. And I'm sure you have a million of them, right? Because 4 years and all the equipment that you say that you are sharing in the meals. Is there one story that in particular you can talk to and how you've made really a difference? And again, Elizabeth, that was a big thing, like a shower. I think as we take for granted showers, right? But is there something else that you can talk a little bit about for a story to share with our audience?
One of the first people I helped so long ago, she was I think she was like 58, and she had just like a freak accident. She fell and basically ended up being a quadriplegic. And she had a good support system. And her insurance was, okay. So it helped get her, it helped her get the item later. So she literally got discharged from the hospital with no medical equipment. And it is one of my biggest, it just frustrates me, because as like a case manager, letting those people leave without having the proper resources, like I just couldn't go to bed at night. Like I would feel too bad. So I know that we all have a job, and in healthcare, we're pretty much always overworked, and there's not enough resources for us. There's not enough resources in the community. So that has been one of my biggest obstacles to actually get people to call me and get the medical equipment, because I have the medical equipment, but it's just like changing people's perspective on, please call me and you'll get your medical equipment no matter what. If I have to go out at 10 o'clock at night after I get out of work, I'll go deliver, that piece of equipment. So I started to know, I actually was her therapist to start, and that's kind of how I started. I was their therapist, and then I helped get them their medical equipment. And I mean, I read the chart and I was like, well, she's laying in a hospital bed. I'm not in a hospital. She was in a regular bed. So I figured she's got to be able to do something. Like, how'd she get in there? I sat her up and she was like jello, and I was like, oh my God. So she got her medical equipment maybe 4 weeks after I started seeing her. So through that time, Saving Our Seniors provided her a hospital bed. So she was able to finally sit up after 8 months of being pretty much flat. We provided her a high back wheelchair. So we provided her a Hoyer lift. So her family was able to transfer her into the chair. And then after she received her medical equipment, we took our stuff back. But in the meantime, stuff as little as like pads for the bed. She probably went through thousands of those during my time, and she would have not been able to afford them. She needed diapers or briefs for herself, adaptive equipment to learn how to feed herself again. So she was one of the first people that I helped, and it was just, she kept in touch with me. She has passed since then, but I will say it's like truly filling in that gap and, being able to provide a resource in a timely manner, because there's a lot of charities that do, what I assist with, but I think Saving Our Seniors is different. And I'm not just saying this because I'm the founder of this. I think I'm a different organization because I've sat beside the seniors when they've struggled to call people and even get somebody to call them back. I've been their advocate and have called different resources to get, to get the resources for them. And they are people, and they were once a teacher, or, they've done stuff in our community, they've given back. And we, the younger generations need to take care of them and help them. So I think that's how I know that's how I'm a different organization, because I understand the importance of not having even a wheelchair to get out of bed. I mean, before she met me, she was just laying flat in a hospital bed, not in a hospital, in a regular bed. So she was unable to do anything. And Saving Our Seniors can truly be that filling in the gap. So you might get your medical equipment, but with insurances lately, I mean, back when I worked in hospitals, we couldn't let them leave until they had their equipment. But things are changing, and they have to leave. But if they don't have their medical equipment, they can get it through us. And then at some point, when they receive their own through their insurance, we can take ours back. But it's just, stories like that on a daily basis.
That's a great service, Kelli. I mean, that story is just, I can't imagine that scenario and then not laying flat for 8 months. Like, how does that happen in the United States? I don't even know. So it's foundations like this that make a difference. Absolutely. Thank you.
Awesome. So Nicole, I'm sorry, I'm going to cover you for 1 second because there's a great testimonial here. So I just wanted to read it from John. It's a pleasure for me to write this testimonial about how I got my, I'm going to wait on that one. Thank you for the testimonial. Okay. All right. So technology, I couldn't see the whole thing. So sorry about that.
I'm hoping he got that taken care of. Good.
Anyways, so
maybe somebody would talk about ask a question with more substance.
Yeah, no. So we're kind of at the wrap up point. So I just wanted to, our friends in the audience, if you have, Kelli is a kind of a one-man show and depends on help from others. And donations of cash would be most helpful at this time and you can go to saveourseniors.org and make a donation there. It will help serve not only the medical equipment side, but also it'll help serve the meal side, right? And serving our seniors in the community that are desperately in need. Thank you so much, Kelli, making a difference. It's an unbelievable organization that you have here. And, so many people are really lucky to have you and all that you do in the community. And then for our friends that are looking for an alternative to pain medication, MedWell is here to help you. Whether you are a senior, you are a Gen Xer, a millennial, one of the things that MedWell, I feel like, and I know Nicole and all of our team can attest to, is education. We want to make sure that we can help you live pain-free at MedWell. So for anything, if you have pain, if you have cancer, there's lots of different ailments, please check out our website at medwellhealth.net. And for those of you catching the replay today, please feel free to leave a comment afterwards. We'll make sure that we get back to you. Ladies, thank you so much for your time today. This has been amazing and a great way to fill my cup on a Thursday morning with all that you're doing. So thank you so much. And thanks, Kayla. And we will look forward to seeing you in 2 weeks on MedWell Unscripted Florida edition. And everybody have an awesome day. Thank you.
Thank you so much.